Good morning and hello. Thank you very much for joining. We will get started, but there are still quite a few people that are joining, but we're going to start on time for those who have logged in on time. For those of you I haven't had the pleasure of meeting, my name is Evelini Tadros and I'm the CEO of the Mental Health Coordinating Council. Welcome to the 10th event in the Advocates and Allies webinar series. Today's topic is very close to my heart and it is taking care of ourselves, support, self-care and vicarious trauma. In the spirit of reconciliation, I acknowledge the traditional owners of the land on which we meet today. I'm on the land of the Gadigal and Wangal people of the Eora Nation here in our MHCC Lilyfield offices, and I pay my respect to their elders, past, present, and those who will continue to hold strong to connections with land, water, and culture. I also recognise and appreciate those with lived and living experience of mental health conditions and trauma, their families and carers, including those here today. Their voices are powerful and vital to the advocacy and reform processes across the mental health sector. These Advocates and Allies events aim to provide mental health and psychosocial support workers with a diversity of information about matters relevant to their work. This webinar will showcase information to help navigate burnout and maintain health and wellbeing while working with people who are experiencing distress and trauma. And it's also quite timely given we're coming to the end of the year where burnout is probably more prevalent. We have three great speakers here with us today, Dr. Melissa Black, Jemima Isbester, and Vicki Katsfis. Each speaker will present, then open it up to questions for the panel, so please post questions in the Q&A section. It is with great pleasure that I welcome our first presenter, Dr. Melissa Black. Melissa Black is a clinical research lead and clinical psychologist at the Black Dog Institute. Her research projects focus on new models of care for depression and anxiety, as well as for healthcare workers and emergency service workers. She's interested in how to better integrate digital tools with person-to-person therapy. Please join me in welcoming Melissa Black, and I will hand over to you now, Melissa. Thank you.
Thanks very much, Evelini, for that lovely introduction. I'm really pleased to be here today. This is one of the favourite parts of my job. So this morning, I'm going to be presenting on the Essential Network program for health professionals, which focuses on burnout and helping health professionals be at their best for themselves and their loved ones, and go over some of the more general information about burnout and stress, which I'm sure many of you will know, but as Evelini said, it's a very topical this time of year. So before I begin, I would like to acknowledge the Gadigal, Bidjigal and Wangal people of the Eora Nation. I'm spread across a couple of locations in Sydney for their continuing connection to land, water and country, and pay my respect to elders past, present and emerging. So I'll cover what burnout and stress might look like in the real world, what might cause it, some of the signs, the impact that it can have, as well as introduce some of the resources and supports that we have available through the Black Dog Institute, so the Essential Network more broadly and a Navigating Burnout program. So everyone probably knows and has a felt sense of what burnout and stress look like for them. And this seems like a really obvious thing to say, but it's something that we continuously have to remind ourselves, I think, that we are humans too, and we do have our own limitations. We bring our own lived and living experience to our work, whether that's of mental health problems themselves or just everything else going on in our lives. And particularly for peer workers, bringing lived and living experience to work every day. And of course, that's a superpower, but can also present some challenges. And so also thinking about how we can apply models of trauma-informed care to our own self-care. So thinking about just awareness of trauma and the psychological and physical safety that's needed, making sure people have control over their lives and their work, acknowledging strengths and connection as really important parts of recovery from trauma. And that common phrase of, thinking about what's happened to you, what's happened to someone rather than what's wrong with you. And so some of the examples that we see a lot of burnt out healthcare workers, and a lot of it is a product of the system in which we work, but there are also some individual factors, and I'll get to those in a moment. But we see lots of doctors, nurses, allied health professionals, other mental health workers through our programs, and everyone does have individual experiences, of course, but there are some really common things that come up. And so people struggling with boundaries around their work, people struggling with very under-resourced and high-pressure environments, and needing to work out what lays with them and what lays with the organisation and how they can best navigate it. So in 2020, there was a survey of almost 8,000 health professionals. Nearly 60% reported high levels of burnout, 70% high levels of emotional exhaustion, and 70% a significant decrease in their sense of personal accomplishment. And of course, this was right in the middle of the first waves of COVID, but we've seen that that's really highlighted the problems that have been there in the healthcare system for a long time. COVID was, of course, a bit of a catalyst and a catalyst for awareness by governments to fund this sort of work, but it has continued since then as well. So there are some individual factors. So we know that people might have some unrealistic expectations about their work and what they can feasibly do within a day or a week or a month. People might struggle with boundaries, and that can be really tricky. And I'm not necessarily talking about boundaries with individual consumers and people that we work with, but also those boundaries around work, finishing times, start times, taking work home. Some people feel a lack of meaning or purpose in their work, and that's really one of those core flags for disengagement from work. People might, related to those unrealistic expectations, people might be a perfectionist. I'm sorry, I'm just getting a bit of feedback. I think someone might need to go on mute. Thank you. And some difficulty implementing self-care. So these are things that often we know to do, but can have trouble doing. There are also some organizational factors, and we never want to discount this within burnout. Burnout itself is not a diagnosis. It's something that is a product of the work and broader environment and interacting with individual factors. So often organizations, anyone working in health, this is not new to you, under-resourced, high pressure, sometimes unsupportive. There are some great workplaces, but unfortunately I've heard many stories of workplaces that are not supportive, and that classic definition of stress where demands exceed resources. There are often long working hours, people might be skipping meal breaks. If people are doing shift work, there are interrupted sleep schedules and vicarious trauma based on the nature of the work that we do. So needing to really think about what might signal burnout. So feeling isolated or trapped, irritable, low energy or motivation, decreased satisfaction, feeling exhausted and drained, feeling disengaged from the work that you value. And those can really be flags. Often, we see that drop off across the course of someone's career, and different things might reignite passion and interest at different times, but that can be a flag of burnout. Poor sleep, procrastination, headaches, and body pain. So these things overlap with depression and anxiety and other mental health conditions, but burnout has a bit of a unique signature, and particularly that interaction with the work environment. So having a think about what signs might resonate with you. You might notice signs within your team members. Sometimes the quality of the conversation around lunch can signal that people might be burnt out. Particularly 4th of December, there was even a Guardian podcast about burnout this morning. It's really common getting to this time of year. Think about what signs for you that your thinking changes when work starts to get to you, and then that impact on your work. It might be the interpersonal interactions you have with others, how exhausted you're feeling at the end of the day, not feeling as passionate or engaged in the work than you previously did. And I think it's also important to look at those two different factors of burnout, so both disengagement and exhaustion, because depending on whether it's a mix of those or one or the other, that might change what strategies might be best suited to help with it. So we know that a few things don't work. They can be nice. I am certainly a fan of cakes and chocolate and massage, but they're not necessarily going to help my burnout long term. And things like random mindfulness classes, apps that might not be evidence-based, resilience gurus, again, can be nice in the short term and can help, reduce some of that stress or burnout on the day or in the week afterwards, but don't necessarily work to sustainably reduce burnout and prevent it reoccurring in the future. We have some evidence that CBT and ACT type strategies can be helpful, but generally looking at those models of trauma-informed care, anything that builds on strengths and connection and belief in recovery, rebuilding control, understanding of the self can help. Some workplace changes are really essential. So for managers, we have a whole separate set of training as well. Psychological safety, connection and support, and that might be through a variety of means, and investment in sustainable coping for a workforce. So I'll talk a little bit about 10, which is the Essential Network for Health Professionals. So this is a blended care service, so both online and face-to-face, that's been running for about 3.5 years now. So we have a number of different resources available on the 10 website, some tools and fact sheets and videos, links to peer support, how to look after a team. We also have a clinic based at the Black Dog Institute, but it's run via telehealth, so available nationally. It's for registered health professionals and students, and anyone who comes under that umbrella. They might not be registered, but who has direct clinical contact with patients or consumers. People can access up to 5 free sessions with a clinical psychologist. We also have psychiatrists on staff if needed. It sits outside of Medicare, and it's private and confidential, so no referral needed. We also have a navigating burnout module, and I'll get into some more detail about this. So through the burnout program, people can pick and choose which sections they would like to access. So understanding more about burnout, we've got a number of health professional lived experience videos talking about what works and doesn't work for them. Connecting with others, tackling unrealistic expectations, setting and communicating limits, some values work, rediscovering what drives you with your work, looking at self-care strategies, and also how to lead a team. So there are just some examples of this, and looking at unrealistic expectations. Some of these might resonate with you. If you're so inclined and interested, please pop a few in the chat of what comes up for you this time of year. For me, as we come to the end of the year and our work shuts down for a couple of weeks, I'm often trying to squeeze in extra appointments with people at times, and things start to bleed out a little bit, and thinking about what's actually feasible. And often these beliefs can be helpful, but also there might be a cost to them. And this exercise is looking at rethinking that. So what's the expectation? Where's it come from? What are some of the internal factors? What are the external factors, those social messages? What are the benefits of holding on to it? Of course, high standards are good, but sometimes they can be so unrealistically high that there might be costs associated with keeping them. And that idea of, what will allow you to put your own oxygen mask on first, and then coming up with an alternative. Thinking about values, so looking at different domains of someone's life, and sometimes there are lots of things that are important to people but can feel out of balance at different times depending on what's going on. And so looking at different domains for someone and going, what's important to them? What can they live in line with? What are they finding it difficult to live in line with? And how can we set some goals around those things to help bring things back in balance? Leading a team through burnout, we know that one of the most important things is psychological safety in a team. So where people know it's safe to raise issues, share ideas, and give and receive feedback. So one way to do this is be really explicit about what is safe, but also for managers and fellow team members, just modeling what can help with creating psychological safety. So people being responsible for what's going on, making tough conversations easier, increasing job control, reducing compassion fatigue, and mitigating moral injury that can be a part of our work. So being able to provide self-reflection and model that, provide ways of sharing ideas. Not everyone's always comfortable speaking up in a team meeting, so knowing that there are different ways of doing that. Inviting feedback, and particularly in the work that we do, and something that I find so helpful within our psychology team, is that peer consultation and being okay to share that you are stressed or burnt out and how that might be impacting your work, and asking for support. And then just finishing with some self-care strategies. We know all these things are good for us: exercise and diet and sleep and feeling connected with community. But looking at ways where things are working and you want to keep doing them, and also new things that you might want to add in or change. I should say all of these are available in much more detail for free on the Navigating Burnout website, so you can jump in and have a look. So if you do require some help, many of you are aware of this. Hopefully you do have some trusted colleagues and friends who you can share these things with. But of course, your own GP, psychologist, psychiatrist, counsellor are all available. Some of those helplines there, and I've just popped the links to the various 10 programs as needed. Thank you very much, and happy to take questions after all of the discussion.
Thank you very much, Melissa. A wealth of knowledge fit in a very short time. We really appreciate your taking the time out to share with us your expertise and knowledge and learnings. Thank you.
Thanks.
And we'll definitely come to you with some questions. I have written down a few, but I'll allow the participants to actually ask the questions. So our second presenter is Jemima Isbester. I'd like to now ask if Jemima can come on camera. Thank you. We've got a few Jemimas, so it's Jemima that's on camera who's going to present. I'd like to now introduce our second presenter, Jemima. Among her many qualifications, Jemima has a Master of Counselling and Applied Psychotherapy, a Certificate 4 in Mental Health Peer Work, and a Diploma of Leadership and Management. Jemima has worked for Sydney Local Health District Mental Health Services since 2013 as a peer and senior peer worker, and was a lecturer in counselling for Sydney University. Jemima is passionate about structures of support that hold space for making meaning, such as intentional peer support, open dialogue, MAD studies, hearing voices and alternatives to suicide, and the integration of peer work into clinical mental health services. Please join me in welcoming Jemima. Thanks, Jemima. Over to you.
Thanks, Evelyn. Hello, everyone. Hello, all the other Jemimas. Sorry, this is totally my fault. Let me just grab this. So happy to see here. Excellent presentation from Black Dog Institute. I really enjoyed that. Okay, so my presentation is called Supervising and Training Peer Workers. So I'm the Senior Peer Worker for Sydney Local Health District, which means my role is about supervising and training peer workers, which we'll go into a little bit during the presentation. All right. Great. The Mental Health Service acknowledges that we're living and working on Aboriginal land and recognises the strength, resilience and capacity of Aboriginal people on this land. The Gadigal, Wongal and Bedigal are the three clans within the boundaries of the Sydney Local Health District. There are about 29 clan groups within the Sydney metropolitan area, referred to collectively as the Eora Nation. We would like to acknowledge all the traditional owners of the land and pay respect to Aboriginal elders past and present. We'd also like to acknowledge the lived and living experiences of mental distress, mental illness, altered states of being of those affected by suicide, and all the people in their lives that care. We also acknowledge amongst us those who remain silent on their experiences. So our district. So what I'll cover next is what I do and how the team works across the district. So this is my favourite infographic. It's very colourful about Sydney Local Health District. So you can see basically we cover from Redfern to Lakemba. We have 5 community health centres and 3 hospitals. So there's the main hospitals is up with mental health in it is RPA, Canterbury and Concord. And there's quite a diverse group of people in our district, from some of the most wealthy people in Sydney to some of the most disadvantaged. So what do? I work alongside Kate Anderson, who's our other senior peer worker. And I also sit in the mental health executive and work along people like these two behind me in our I really love workplace selfies. So here's a workplace selfie with me with the Clinical Director of Mental Health Services, Dr. Andrew McDonald, and Stephen Wood, the General Manager, as well as Kate. So this is part of our role, is to influence from an executive level as well. That's just a week in my diary, so you can see all the kinds of things I do. I do systems advocacy, I do education groups, I do the LEAP committee. So if anyone's actually received support from mental health services in Sydney Local Health District, we have a group that meets once a month called Lived Experience Advisory Panel. It's an excellent group to be part of, and if you're interested, please email me afterwards, and we're always looking for new members. I also work on building working groups. I do inpatient groups and one-on-one peer support. So this is a map of our services in the community and our services in the hospital. So we have statewide services, intellectual disability, mental health, and eating disorders. So everywhere you can see a little pink star is where there's peer support. So there's that. Oh, yeah. So you can see we've got it in child and adolescent mental health, adolescent community mental health, acute care. We have quite a number of people in acute care, peer workers, adult care coordination teams, assertive outreach, Aboriginal mental health, carer support, early intervention. We have specific health peer workers that came out of Living Well, Living Longer program, have transfer of care, peer stock workers, peer workers at the Safe Haven, peer workers in our suicide prevention outreach team. We have peer workers in eating disorders in Walker and Rivendell, which is for young people, in Nauru, which is a parent and baby unit, and in acute mental health at Concord. So you can see they're everywhere and they're integrated into the team. So we don't have our own unit separately. We're part of the overall teams. Hang on, I'm just trying to, who would think that changing the slide is so hard? Wait, maybe I need to turn this off. Oh, okay, so my presentation posits that we should prevent burnout with PUGs. Yes, PUGs. It's an acronym that I've made up for today. So supervision and self-care. So basically I had a look into peer work and burnout. One paper that I'm referencing, I'm one of the authors on. So that's I don't know about doing that. But anyway, so basically there's a paper that came out in 2020 that says peer workers are not more burnt out than the average mental health clinician, which I think is a good point to make, because often we're seen as, maybe fragile, or, we do need extra support, but I don't think we're a fragile group of people. I think we're very resilient. Peer workers report not enough understanding of their role and lack of hours as major reasons for leaving their position. So we think here in Sydney that supervision should be implemented regularly as a strategy to prevent vicarious traumatisation, and to really give more workforce stability. So there's a sense that people always have somebody to talk to about what's going on at work and to manage their stress. So this one here, I've used this poem. It's from Kay Tempest. I particularly love it in terms of thinking about how I like the kind of things that I live with, the pains that I'm living with every day. And that's a photo of me being upset. This one here is looking at what causes burnout in peer workers: insufficient support, not knowing where we begin and end, and maybe an emotional investment leading to burnout. I think this is the thing with peer work, is that we are so close to it. We're still experiencing it often, and people in our network of friends and family are often experiencing it. So we're quite invested. Like, I think I think we're the best in mental health because we care a lot, but that care comes at a cost. Okay, so the PUG method. Prioritize your supervision. So put it above all the other things. Don't let it slip. Like, I know you want to get out there and support those consumers and really be there for the people, because you know that it was so helpful when people were there for you. But make sure your teapot is full, so then you can pour that cup of tea. Use your supervision. Let those feelings out. So really lean into supervision and talk about the feelings that come up in being part of providing supporting relationships. Grow in supervision. Open up on what you're not sure about and take that time to grow. So peer supervision, is where a peer work in this context is where a peer worker provides supervision to a peer worker using the values and principles of peer support, so mutuality and reciprocity, to create a co-learning relationship. In Sydney, what we do is when people come, we've structured a flow chart of how often supervision will happen, as well as who else will contribute to supervision. And so there's the peer worker, there's a line manager who gives specific information, then the senior peer worker, and there's also a team mentor. So having a look at, I've been doing this for a while now, how I survive or thrive, depending on what's going on. I get supervision for myself from another peer. I meet regularly with my line manager. I often meet with a mentor and collaborate on projects. And I make sure I build wellbeing into my schedule. So that's prayer, meditation, swimming, time at the beach. I started playing trumpet again. So the body does keep the score. Like I could actually remember after 25 years of not doing it, I picked it up and I could still do it. So it's kind of cool. Singing, coffee with the girls. We also offer workplace wellness plans. So it's just about having a look at what helps you be at your best and what might help in a rough patch. You can also ask people for reasonable adjustments, and I would encourage people to, if you're in a peer role. I think certainly these are all very reasonable things to ask for. Vicarious trauma. So I think that the first presenter, Melissa, did a much better job on me on discussing what vicarious trauma is. Basically, my message is working in mental health is stressful. So have a look at some of these things that could indicate that you're experiencing a bit of stress. Training. So I think it's really important to access lots of training and go deep on the understanding of what the role is, because not getting what your role is can lead to being overstretched, which leads to burnout. These are some ways that organisations can support peer workers in avoiding burnout. So making sure we have common job descriptions and reporting lines, that we all have access to supervision, that the team leaders collaborate with the senior peer workers, and that the culture is supportive. And luckily for us, Sydney Local Health District, been early adopters of peer work and early to expand. So just some future possibilities. Bigger peer workforce with more leadership positions, free online peer work supervision training, building communities of learning across New South Wales. Should we have peer work in Parliament? More supervisors, more organisers investing in peer work, more jobs for people with mental health issues. So thank you so much for listening. You are awesome. Thanks for taking the time to think of yourself in terms of your own trauma that you're experiencing at work and your self-care. These are my details. Hit me up. I'm very good on email, and I'm happy to talk anytime. So thanks for listening.
Well done, Jemima. I hope you can see the love and support that's coming through both the chat and through the emojis. I look forward to also asking you some questions, or at least from the participants. Thank you for sharing your experience with us. Our third presenter for today is Vicki Katsfis. Vicki has worked in the mental health peer support sector for 28 years in the inpatient, community education, non-government and multicultural mental health settings. Vicki currently works at the Southeastern Sydney Recovery and Wellbeing College as a senior peer leader, senior peer learning advisor, educator, freelance peer supervisor, and a casual trainer. And it's my absolute pleasure to now welcome Vicki. Thank you, Vicki.
Hi, hi everyone. I'm really enjoying these presentations. So I'll just get my presentation ready. All right, so from the beginning. So before I start, I think that's not from the beginning. Before I start, I just wanted to acknowledge the Gadigal people of the Eora Nation here where I'm sitting today, and pay respect to the many other lands we're sitting on, and pay respect to all elders, both past and present. And I wanted to acknowledge the lived and living experience in the room, but particularly I wanted to acknowledge my friend Simon Champ, whose artwork is behind me. He is one of the pioneers of the mental health consumer movement. He was the first consumer to be at the Themes conference and to talk about his lived experience. And I really acknowledge and respect what I learned from the elders in the movement. So I'm going to be talking about supporting the developing and emerging peer workforce and looking at how the Southeastern Sydney Recovery and Wellbeing College does self-care and how it teaches it, and how we support our staff at the college. So just a bit about the college to start off with. It was established in 2014, and we only had a few educators to start off with. I think there were about 5 peer educators. We'll look at transformation, so transforming people through adult education for recovery. We embed co-production, which is co-writing, co-facilitating, co-learning and co-evaluation, making sure we smash the power differentials and there's equality with clinicians and lived experience. We have an extensive educator learning and development program, which really helps our new peer educators. We offer about 30 courses per term, and we've co-produced over 100 courses. So these are some of our objectives. We believe in personal recovery, but mainly that people can move beyond using mental health services and just live a very full, authentic and self-determining life. Service transformation, so making sure we teach services and staff recovery-oriented courses. Capacity building, so building our peer workforce and our clinical workforce through our courses and events. And employment, vocational pathways for our students. We have 3 categories of courses. So understanding mental health, drug and alcohol experiences and treatment options. Stream 2 is all about our lives and rebuilding it and really getting on with things, developing knowledge and skills in recovery. Particularly, there's a lot of courses around self-care, which I wanted to focus on today. And then Stream 3 is recovery supporting practices and getting involved. The eligibility criteria is free of charge to people that are 16 years and over who have mental or suicidal distress and they live in our catchment of Southeastern Sydney. Their families, carers and support people can be from other suburbs but still attend. Other residents in the community, that's a new addition. You don't have to have mental distress or be a family member or carer to come along. So that's really good about promoting mental health and wellbeing to the community. The staff, sometimes we have students on work placements and volunteers can come from the college. And the staff of our partner organisations. Some of our partners are employment agencies and community colleges. This is a lovely picture of us all learning together, and people are learning about hope, one of the very important foundational recovery principles. So to start this presentation, these are some of the pathways for emerging peer workers. Our students can become peer educators, and it's really wonderful to see people flourish and get involved in peer education. Many of them have never taught before, but we have a really good way of teaching that's very gentle. They start off first doing the education training program. There's some courses like Educating for Recovery Foundations and In Practice, Skills for Co-Facilitation, writing courses, and they can observe as many courses as they like until they feel comfortable. And they also, when they start, they work alongside experienced peer or clinical educators, and they decide what their passions are. A really good success story is somebody that had a lot of barriers, a student that had literacy and numeracy issues and many other barriers in their recovery, and they have flourished. They've become such a really great peer educator in a lot of different things like the legal system and also drug and alcohol experiences. We've also got volunteer peer workers. So I work as a senior peer learning advisor, and I can supervise someone if they want to come in as a volunteer, and they can provide peer support work to our students, which is student learning plans. So the volunteers, there's been about 4, there's a 4th one just starting, and we've had 3 volunteers so far. And one of our volunteers did the certificate in mental mental health peer work and was able to do the placement hours, which is really good. So some of our support for peer workers, what are the courses that help them develop? We have an introductory one called Introduction to Consumer and Peer Worker Roles. We have activities in that course around ethical dilemmas, which happens a lot in peer work, boundaries and the importance with that, with self-care, and mutuality and reciprocity, and a bit on the history of peer work and qualifications. We have a course called Committee Work, where people can role play a committee and learn how to deal with challenging situations. So this is another really nice photo showing everybody working together. That might have been a celebration, but I think it's a course as well. So that's when people have something to eat along the way. Now, I wanted to look at more support for peer workers. We do teach purposeful storytelling about safe disclosure, and this really helps with people's self-care, how to learn and maintain personal boundaries, which has been talked about, and how to be trauma-informed, and how to purposefully tell aspects of their recovery story and stay safe. There's also developing your story, which is an advanced one, and it's developing, amending, editing lived experience stories. And this is a picture of our pioneer, one of the other elders of the consumer movement, Sandy Watson, who works for Inside Out and Associates. She was the one that originally developed the Purposeful Storytelling course. And it's an amazing course. It's so rich, it's so deep in wisdom, which I love. And then we've got a newer type course, Suicide Prevention for Peer Workers, and they do look at working with vicarious trauma in that course. One of the activities is being able to identify your feelings, thoughts, beliefs, how you're behaving when you're triggered whilst working, just increasing self-awareness of when it's happening, because sometimes we're not really sure or we can't verbalize it. And then being able to think of grounding techniques you can use in that very moment. And this is a picture of the Suicide Prevention for Peer Workers course. It was during the pandemic, so everyone's masked up. And we have our lovely presenters and educators in the photo, Max Simonson, Flick Gray, and Darren Wagner. And that's a very pioneering course, which I'm in there too. I was very happy. I actually want to repeat the course. We have an information session that MHCC collaborates with on the Certificate 4 in Peer Work, so our students can learn about it. And telling your story in a public forum is an introductory course if someone wants to tell their story publicly. They may not be ready to move into peer work, but they might want to tell their story in courses such as Understanding Mental Distress. Now I want to look at self-care and what does the college do around self-care to help with things like burnout. Some of the things we teach are creativity. I think it's so important if you feel so inclined to get creative. They do a group final project such as a painting. They also did angel wings, these amazing extended wings that they painted, and a recovery tree was this amazing installation in the lobby of our old college with leaves that has phrases on recovery. An introduction to recovery in the strengths approach looks at 4 positive things about yourself. It's quite strengths-based and how to elicit strengths in yourself and others. This is a photo of the Angel Wings project of the creativity course, painting some wings and putting them on a big piece of cardboard. And the recovery tree, everyone was so happy with this tree. It's got recovery phrases, recovery sayings that have come from the students themselves. And Elise Blaney, my colleague, is in that photo, and she's very creative. She's got a degree in creativity, and yeah, she's helped with that tree. Other things we do are decorating a recovery box in the Life Beyond Depression course. You decorate a box, then take it home and put really important things that you need for your recovery. Being able to externalize emotions. In this Exploring Grief and Loss course, we use self-drying clay to externalize and express grief. And then we have a few trauma courses where strength is used and self-care. This is a photo of a clay flower that one of our students put down. And I think it's important with peer workers or students to be able to externalize their emotions, the way they're feeling using artwork. If it's only if you're so inclined and you like art. But we recently had a Wellbeing day, and I'm actually not a painter or a drawer, but I got stuck into the crayons and did a little painting, and it was very therapeutic. We have a men's health course where we do mindfulness and breathing exercises and using scented hand cream, learning how to cope with strong emotions, changing body temperature and resilience, having gratitude journals, and increasing awareness of self-talk. And I think that's really important as a peer worker. Sometimes things come to me, I'm not sure. Knowing your awareness of what you're saying to yourself, and then you can come to a colleague to talk it out, or a manager, or bring it to your supervisor. Just being aware of what's happening as you're working. We have recovery stories course, learning how to write your recovery story, and spirituality and well-being. People engage in journaling, meditation, spirituality box, or other things like choose your own adventure. Just a quick mention about what I do. I support students with a student learning plan. It's a chance for students to get together with a peer worker to discuss their barriers, their learning goals, what are their strengths, and what support they need. And peer workers have had in the district have had student learning plans as well, and have found it really helpful. It's a plan around your learning, so they can really focus on their professional development and what they want to focus on. And this is a picture of Ben Steele, who was our drug and alcohol project officer, and we used to do learning plans with our drug and alcohol lived experience students. Events, I feel, can promote self-care as well and give us a reprieve, a bit of a gap in doing the day-to-day bread and butter. We had a Share a Cuppa Mental Health Month event where we had a promise wall and people put their promises to their recovery. Every term we have an orientation day and staff get involved, new students come along, and we try to make them feel comfortable. And peer workers bring people along as students. We have an annual feedback session and a celebration of learning where we celebrate student achievements. This is a photo of the Share a Cuppa Day. We have the promise wall behind us, and that was a really fun day. And our student feedback sessions are always really, really fun. We try and make them a bundle of laughs and everybody feel good about themselves. Elise is there, my colleague. And one time we gave away ukuleles because we had an overflow of them in the creativity course. And this is one of those days where everyone's in a good mood. Celebration of learning, that's a picture of the transcripts. We have our executive, they get to shake hands with the executive and have a good time, and we're all together. To finish off, I just wanted to look at the self-care for the staff and what we do. We have debriefing quite often. I can just come up to my colleagues at any time and just say, hey, I really need a chat, or something's just happened. And we've got some good consultation rooms we can go into. Again, with Jemima talking about peer supervision. So we have group supervision we can go to and individual. I must say, though, we need to get more peer supervisors around, because for some people we can't find the peer supervisors, so might for a temporary time be a clinician. We encourage walks throughout the day. We have a wellbeing program in the whole southeastern Sydney district where we do dancing, yoga, meditation, free activities. I organise a monthly peer worker lunch just so that peer workers can get together and we don't talk about work, we just have fun. Informal check-ins with each other, which I love, just going up to a colleague. My manager recently tried to encourage gaps in my calendar, which I'd never thought of before, because I usually do things back to back. And she said, you need gaps. And I thought, wow, that's going to help my self-care. Pets are allowed at work if they're approved. We did have Princess Bella, a beautiful Maltese terrier, that one of our colleagues, she doesn't work there anymore, but for about 2 years, we had that, and voluntary wellness planning, and a weekly debrief with the senior peer worker that we do, and a sensory room that we can use. That's used for Safe Haven, but we can use. Yeah, and that's, oh, sorry, I pressed the wrong button, I think. Yeah. I just wanted to say, though, to finish off, we teach so many self-care activities and different things. But what I believe, and it's just a simple message, is it's all in the implementation. It's really good to learn a lot of stuff, and often people get excited when they learn it, but it's all in putting it into practice and actually doing it consistently so it does, I guess, work. Thanks, everybody, for listening.
Thanks, Vicki. You've covered quite a lot of ground in a short time, and I'm sure you can see the emojis and the applause. So thank you. I think there's a lot covered there and lots of the creativity that we can bring to this space. So thank you. If I can ask Vicki to stay, but also invite Jemima and Melissa to go on camera, and then we'll get through some of the many questions that have been coming through. And just wait for Jemima to join us as well. Perfect. Thank you. So we do have quite a number of questions. I might start with you, Melissa. You spoke about boundaries, and I know this is something I grapple with. How do you balance out those who want the flexibility to work outside of the usual 9 to 5 hours, but then be sensitive to the boundaries of others? So if someone sends an email at 10 o'clock, is it up to the recipient to set their own boundaries and respond to that within their own timeframes? I'm curious to hear your thinking around that.
Yeah, really great question. And I think, there have been a number of questions around reasonable adjustments and all of those sort of things. And I think partly it's an organizational directive that that there need to be some clear expectations of when people might need to be online or on site and when they don't. And I know at Black Dog we're very fortunate that they've encouraged 2 days a week in the office, but can be flexible and encourage 10 till 4 as the core working hours, but can be flexible. So there's some guidelines which help. Some other things that I've seen that are really helpful is often as the sender of an email, that's a really good example. They might put on their signature, I'm working in hours that suit me. I don't expect a response outside of regular working hours. So I think that's a nice way to share responsibility. And then similarly on, say, the recipient of an email, working out what your boundaries are, and going, sometimes it is really helpful to have that flexibility and to get through emails in the evening when all the traffic's kind of died down and you might have finished putting your kids to bed or whatever it is, but not expecting that and just being aware of what's appropriate for you. So I think that shared responsibility, both the organizational, what expectations you're putting on others and then the expectations for yourself.
Great. Thank you so much. The next question is for Jemima. Peer workers, the Scanlon reference that you made for peer workers and not being more distressed than other health workers, did they account for the role of supervision and support in any of their research?
So the article, the peer work article, it's about stress and burnout with peer workers. They talked about the main things that came up from the article were people who were people's main issues in peer work were not having enough hours and not having an understanding of what their role is. So I think the role was the main thing. Access to supervision, not as much, but because peer work can be sort of ephemeral, like it's sort of, there's a lot of motherhood statements about peer work, but there's not necessarily not everyone agrees on the ABCs of a peer worker job every day. So I think getting clear on what that is in each organisation is really important.
Thank you. There's a lot of questions, Jemima, about whether peer workers exist in other LHDs, which you might want to provide comment on. And the other one was around the PUG model. Is it specific only to the Sydney Local Health District? What happens in other LHDs, particularly in rural and remote?
Yeah, so peer workers are not only in Sydney Local Health District, but in all of the local health districts across New South Wales. And I'd probably say Australia. I don't know exactly, but also they're more heavily representative in the community managed sector. So places like Flourish Australia, they have the most amount of peer workers hired. What was the second part of the question?
The PUG model, whether that's just specific to the Sydney Local Health District, what happens in other smaller LHDs, particularly in rural and remote?
Yeah, that's specific to us. I guess we are lucky because we're in the city, so we get a lot of resources And I'm hoping in the future to think about ways to reach out to rural and remote areas and sort of provide them with some of the things that we have or somehow share. We do have I know as seniors, we have a statewide co-reflection group with the other seniors in the state. But yeah, no, it's not equal in each across the state at the moment.
Thanks so much, Jemima. Vicki, a question for you. There's lots of questions about where the recovery colleges are located. Are there more than just the one that you're referring to at the moment? And are there any in regional New South Wales again? So I'll leave that one with you.
Yeah, sure. The very first recovery college was in Melbourne. Mind Australia, I think, was a non-government organisation, and they organised that. They were slightly different in they had professional educators. They didn't necessarily have clinicians, but at the moment in Sydney, there's us, Southeastern Sydney, but there is also the Western Sydney Recovery College, which is run by One Door. And I think there's a Southwestern one. We had a conference with all recovery colleges in Australia. There used to be one in the Central Coast, which was sort of regional, but I think that has folded. So at the moment, there's not as many, but they're all in different models. So ours is within New South Wales Health, within a local health district. So we get a lot of our students who are already clients of the health service, but there are models in non-government organisations out to the community. Hopefully more and more. I can see something, Central Coast is in the process. Yeah, well, that's great. And I think there was another one too, but I can't recall which area. We would love for more and more to pop up because I don't think there's enough. And what I don't really like, and it's hard, but it's a limitation from funding, is that we can only present courses to people in Southeastern Sydney, like we're not statewide. Yeah.
Okay, there's a lot of questions on that. So there's I think that knocks off about 7 questions. So are there courses available in Western LHD? I think the answer to that is no. Are there any region? We can offer it in Western?
Not in the LHD, but in the community, Western Sydney Recovery College. If you live
in Western New South Wales, as in country, Western New South Wales, not Western Sydney. Okay. That's all right. So that one's that. And so the regional recovery colleges, there's probably only the Central Coast one that I think some comments have been made in the chat.
That's right.
And the only other one around recovery colleges is, does the college provide any external online learning and courses? So something about online capacity.
Yeah, there may be in the future. I can't comment that much, but those are sort of brainstorming and things that we've thought about, but they're not actioned at the moment. Yeah,
not a problem. There's a question from Michael here. I read recently that we need to lessen the empathy and increase compassion to address burnout. Feel for rather than with. Is this still peer? And I'll open that up to maybe Jemima and then any others who may wish to comment.
Sorry, can you repeat the question?
Yeah, of course. I read recently that we need to lessen the empathy and increase compassion to address burnout. Feel for rather than with. Is this still peer?
Feel for rather than with.
Yeah, it's a bit philosophical, I guess. Empathy versus compassion and the difference between empathy and compassion.
Is it empathy or sympathy?
Well, this person's written empathy and compassion.
I feel like as peer workers, it's kind of, I feel like
maybe it's not either or, it's and. So you need to have empathy and compassion. It's why do we have to have in this black and white either or?
Yeah, I think it would be empathy and compassion. It's almost like, because what you go through often crosses over with what other people go through, it can feel like you really understand what the other person's going through. But I think it's good to remember that you can't understand exactly what somebody else is going through, even if you feel like you have a good idea, because maybe you've been through something similar. to make sure that you're checking in with that person about what it is that they're feeling and thinking, and not making up an idea of like, you know what it's like because you've had that experience. I think that's important to peer work, like to reflect on that. Hopefully that answers the question, because even if, like, say I've been homeless, I've experienced domestic violence, that's not going to look the same as if Vicki had gone through that or you've gone through that. Like, so you've got to be able to reflect on that as well. And that's part of what you do in supervision.
Thanks, Jemima. And another one for you. Great presentation. What do you advise for peer work members who can't get supervision? That's just not part of the course of what they do, or what they get, I should say.
I think try to find other peer workers that you know and create your own little network, the DIY. So I'm all into punk rock, do it yourself. Don't wait for them to give you supervision. Look up things like, you can go on the internet and look up intentional peer support co-reflection guide. And even if no one's ever trained you on it, they actually put step-by-step how to do it. So you could start your own regional co-reflection group online with just other peer work mates, just to practice it, get in there yourself, because you know what it's like. Sometimes you get what you want and sometimes you don't, and you got to make it happen for yourself.
Oh, such great advice, Jemima. Thank you very much. I think this might be a question for Vicki, but I'm open to anyone. What is the HETI training, or HETI training, for peer workers?
My understanding is that's the health education training, New South Wales health training, but it's not just for, there's not many peer work courses on that, and that encompasses the mandatory training that health workers have to do. But then there's other training, like I've done training on research, training on Microsoft Office, but I don't know whether Jemima knows whether there's any peer specific courses on HETI. I'm not sure myself.
I think I referenced it in my talk as training that we get. You can do lots of courses through HETI that are helpful. They're not necessarily peer work courses, but you can do things like motivational interviewing, which is cool, or what else? Even suicide prevention. Like, there's different courses you can do that can help you to build yourself up in your knowledge.
All right, thank you. We have a question here. I'm a person who has lived experience as well as formal mental health peer work qualification, but my work role is not a peer identified role. What support or work adjustments are reasonable for me to request? Who wants to start with that one and see if there's others who want to jump in on it? So someone who's got the formal qualification, not in identified role, but would like some, or is, potentially looking for some work adjustments that are reasonable.
I can, I'm on a flexible work practice at the moment. So my role is 4 days, but for 2023, I've been working 3 days a week. And that's just because I have carer responsibilities, other health issues. That's just one thing you can do. If you work in New South Wales Health, there is flexible work practice. Yeah.
I think the only other thing I'd add there is it's probably reasonable to ask for any work adjustments, regardless of whether you're a peer worker or a person with a disability or you're a carer. So I think that's a question you might need to ask yourself, is say, what do I need? And then go to your supervisor and have those, questions and conversations. And I'd like to hope that most people are reasonable. And there's also the national employment standards that dictate what is, minimum adjustments that need to be accepted. Okay. Let me have a look. So this one I think is for Vicki. Do you have these wonderful recovery learnings for age specific, e.g. older persons?
Very good question. We're working on an older person's course at the moment, and I went to an older age forum in the eastern suburbs so we can promote the college, and we tried to get feedback from older age people. There isn't a young, because we are over 16s, we don't have a youth oriented course, But we also have, I didn't mention, we've got courses in different languages and cultures. So we've got courses for the Greek community, the Arabic, the Macedonian, and the Chinese. So often in the Greek one, there's a lot of older age people attending that. But yeah, we are going to work on another course on older age. Thanks.
Thanks, Vicki. Jemima, this one is a little bit personal, but I'm going to go there. Often, yeah, and you mentioned the word resilience in your presentation, that often you see, and you're in your own experience, peer workers are quite resilient. How do you personally maintain that resilience for you? And what makes someone's resilience higher than another person's?
Well, I think it's complicated. I think I want to acknowledge I've got a lot of privileges. Like I've had a lot of access to education. I'm currently in housing that's subsidised housing, so I'm not being impacted by this rental crisis. I'm in a permanent role with the government, so I don't have fear that I'm going to lose my job, or that week to week I don't have shifts. And I think those things really do impact on your mental health, like having permanent housing, permanent employment gives me a better base to stay well. Besides from that, I engage in treatment and, I'm a single mum, so I try my best to look after myself. Like I've got little hacks for single mums. Like if you want, like my son has swimming lessons twice a week. So when he has swimming lessons, I go on swim laps. So that way he's covered, and I actually have like 20 minutes to myself to go and try and like build myself up. But, you got to take your space where you can, and it's based on what, on wherever you are at a time, and sometimes I'm doing better than I am other times, I'm not always resilient. Sometimes, like I struggle, and I just think, what's my motto? It's stolen from, I think, Eastern philosophy. Before enlightenment, chop wood, carry water. After enlightenment, chop wood, carry water. So the dishes still need to be done, and the bins still need to go out. And that's kind of how I do my recovery. I don't know if that makes it simple. Like my recovery is based around doing the making sure that there's food in the cupboard, but also trying to find little space for myself to feel good and do things for myself.
Jemima, again, absolutely brilliant advice, because sometimes keeping it really simple, like making sure there's food in the pantry, rather than trying to solve everything at once, it's, taking those small little bites of activity through, I know I read somewhere that the best activity you can do first thing in the morning is make your bed, because you already feel like you've actually made your first achievement. So thank you for sharing that. Melissa, I have a question here. What, if anything, makes your one-to-one sessions with clients different from counselling or psychotherapy sessions?
Yeah, really good question. I think there's a lot of overlap, and it's something that a lot of people come with questions, and anyone who's experienced mental health services will know there are lots of different flavors, lots of different models. And so in our service, we generally work within some of those more structured psychological models. So things like CBT and acceptance and commitment therapy, dialectical behavior therapy, and schema therapy. But there are lots of similarities, and I saw in Jemima's bio working with things like open dialogue, creating more space for people to open up about their experiences. And I think the art of psychological therapy is being able to tailor it to people and work out what do they need. I certainly have sessions with people where people need much more of an open dialogue type approach. Let's just explore this. What's here? What's the space? I'm not going to go, well, let's put this in a worksheet. But some people really like the worksheets. They like that structure. It helps solve problems. So it can be flexible, but I think most importantly, it's about finding what works for you. You might try one thing and go, that's not what I need right now, or that's not what I want. That didn't fit for me. I'm going to try something else.
Again, Vicki, I think that's great, because, in yarning circles, they often, problem shared is a problem halved. So just being able to talk with someone about it can sometimes either de-escalate an anxiety or a problem and break it down, as we just said before. Vicki, another question for you. How do you work with peer workers who work with young consumers who are suicidal when they have similar lived experience? That trying to be compassionate, but potentially separate your own experience and trauma from what that consumer, what that lived experience worker is lived experience person is experiencing. So I've probably muddled up the question. The question was far more clearer before I added in my 2 cents worth. How do you work with peer workers who work with young consumers who are suicidal when they have similar lived experience?
I think one of the ways, because I work as a casual on our safe haven, and one of the things that I thought was really important is we role play a lot of different scenarios that could come up. These things are really difficult because when something happens in the moment, you can't exactly say, I've got to go, I've got to take a break. It's very internal, and you've got to kind of self-care within the moment. And then when you get your break, really know how to have a good break as well. So I think it's a lot of practicing and a lot of talking, role playing. So the more you see these presentations, the more you have ideas and strategies of what to do. I think when we're new peer workers, it can become very overwhelming. And that's where, like Jemima was saying, supervision is really important. But I like the check-ins, like as a casual at Safe Haven, when I'd have experiences that I didn't know what to do with, and I had a little break, or I left for 10 minutes and just told people, I'm just going to be 10 minutes, I would go and sit with the coordinator and workshop it and role play it. I'm sure there's other different ways, but I think it's the more you get to know what's occurring in the moment and you've had practice and you've discussed it, the more you talk about things, not just supervision, but like I might be repeating myself, but I like the check-ins with colleagues or the coordinator or the manager, just saying, hey, this has happened, I'm not sure what to do. But I think also doing courses like purposeful storytelling and really understanding how to put boundaries around your own story and boundaries around yourself to keep yourself safe. The more training you can do, discussion, and journaling as well, I think is really good. You can journal these situations and how you're responding and what you're learning. Thanks.
Thanks, Vicki. And Jemima, a very similar question, but for you, when supporting peer workers in their role, what unique considerations and supports are required to ensure that their own lived experience and living experience is taken care of and not impacted by the work with consumers?
They will be impacted by work with consumers, and that's okay, and I think when you go to supervision, it's going to be about talking about that impact, and part of processing the impact of it will be talking about it and reading about it and listening to podcasts and doing whatever you can to sort of get your head around what's coming up for you, doing your own work in your life. But I think that applies to like all mental health workers. Like I think we all need to be doing our own like growth work all the time to stay in connection to people that we're caring for and with.
Thanks, Jemima. And there's a beautiful comment from Justin that's come through that says the presenters are all great examples for us. So, that role modeling and leading by example. I think I'm going to go to one question that each of you need to provide a response to. Can you speak about how you care for yourself on a day-to-day basis in the work that you do? So start with you, Jemima, and then Vicki, and then Melissa.
I'd say high quality hand cream is key. Just some really nice hand cream to have. I've also got some cuticle oil that I have at my desk that I like to just put on, like paint my nails with the cuticle oil, take a minute to myself, make sure I have lunch, have supervision, plan holidays, try not to take myself too seriously. Yeah, definitely never underestimate the hand cream. And I've got like a nice in my drawer, like a heat pack. Sometimes I find it's nice to get the heat pack out and not have some good quality tea. Like if you work in health, the hospital tea doesn't cut it. Like get some good tea and sneak it in your drawer just to look after yourself. Yeah.
Thanks, Jemima. I love it. Vicki.
Yeah, I think for me, I do like a walk once a day. It's about 10 minutes. It's just around the block. And it's really important to me. It really helps me just to get out in the fresh air and just leave the actual space for a while. And I can see that other colleagues do that as well. Like I said before in my presentation, we have like a sensory room for Safe Haven, but we can use it as well. And if I'm really overwhelmed, I will go in there, close my eyes. There's beautiful muted lighting. There's massage chairs. But sometimes it's just being able to close my eyes and be in a quiet, safe space. Of my supervision, I have just a wonderful supervisor, and I love being able to go to supervision. I think having peer worker lunches, going out with people. But for me, probably the check-ins, I just keep repeating it and love it, is just being able to say to my colleague, hey, something's happened, can we chat? And it's just really nice. We all help each other and we all give each other ideas around our projects. And our manager, we've got an acting manager at the moment, but she has so much compassion and is always checking in as well, like, how are you going today? So that helps me.
Brilliant. Love it. Thank you. And Melissa.
Yeah, no, I love all of Jemima and Vicky's self-care practices. I'm definitely going to take a few. And I think what's standing out so far is that psychologically safe workplace, which isn't something formal, really. You know, there are some formal things, but it's how you feel and those informal chats with colleagues. You know, we certainly have a standing unwritten agreement amongst the psychology team. We, pop into someone's office if you've had a challenging session, or you go, look, I'm just feeling really foggy. Can we go for a walk and grab a coffee? High quality hand cream is key. I'd also say high quality chocolate is key. I've got some stashed in my desk. And for me, along with exercise, walking and cycling, some mindfulness, which isn't really formal. It's for me, it's baking. I love baking bread and cakes, and that's my form of mindfulness, something really sensory that I really like to do. So yes, lots of different things, but I'd say the psychological safety and the team supervision is really important.
Thank you so much, Melissa. And probably ones that I would reflect on is I'm a fanatical diary manager. So I think someone said before about creating blank spaces throughout the day. I fill it in with, go and have lunch or no appointments at this time, because that just gives me my space to either clear emails or just have a conversation, walk the room, so to speak, or walk the office. So I definitely am a fanatical diary manager. And swimming and exercise for me, I think we can't separate the importance of exercise and increasing serotonin levels and reducing cortisol levels. So exercise for me helps. I walk in as grumpy and by the time I walk out, I'm actually smiling and a little bit more pleasant. So thank you to our three wonderful presenters. Please join me in thanking Dr. Melissa Black, Jemima Isbester, and Vicki Katsfis. A wonderful couple of hours spent just learning from everyone's experience, and hopefully we can continue these conversations in one way or another. This webinar will be available in a few days from MHCC's website, and the presenters have given us permission to share their presentations, so that will be available also in due course. Participants will be sent an evaluation following the event, which is important to MHCC in continuing to facilitate these quality sector development activities. I take this final opportunity to thank you for all the work that you do each and every day in the sector and engaging in the work of MHCC. I wish you a wonderful summer break and look forward to seeing you and working with you in 2024. That draws this webinar to a close, and thank you again very much for your time.